Did you know that during the height of the COVID-19 pandemic, one country was throwing away millions of expired vaccine doses, while another was reusing syringes because it had none left? In a world where science can create miracles, survival still depends on privilege. The greatest breakthrough in modern medicine, the vaccine, has become a mirror reflecting humanity's deepest inequality. Hello and welcome. Today we are exposing one of the most uncomfortable truths in global health. The price of survival inside the global vaccine inequality. This story isn't about viruses or lab discoveries. It's about power, profit, and politics, how the ability to live or die can hinge not on biology, but on geography. When vaccines were rolled out, they were called the light at the end of the tunnel, a promise that humanity would rise together after years of fear and loss. But that light didn't reach everyone. In wealthy countries, vaccines arrived by the millions, stacked in refrigerated trucks and administered in sports arenas. In poorer nations, nurses waited for shipments that never came, hospitals pleaded for doses, and families buried loved ones before their turn ever arrived. By mid-2021, 10 of the richest nations on Earth had secured more than 75% of all available COVID-19 vaccines. Meanwhile, entire continents, home to billions, had vaccinated less than 2% of their populations. It wasn't science that failed them. It was the system that decides who gets access to science. This inequality isn't new. From smallpox to Ebola, from polio to COVID, vaccine access has always been shaped by the same forces: money, patents, and political will. History keeps repeating itself, and the same question lingers. How much is a human life worth when survival comes with a price tag? In this episode, we'll uncover how vaccines, once symbols of hope, became tools of division. We'll trace how global health promises were broken, how pharmaceutical empires rose, and how the world's most powerful institutions allowed millions to be left behind. This isn't just about the past. It's a warning for the next crisis. Because if inequality can decide who gets to live through one pandemic, it will decide who survives the next. Before we confront the politics behind vaccine inequality, we need to understand what global health experts actually mean when they talk about vaccine equity. The World Health Organization defines it as fair and equitable access to vaccines for all people, regardless of income, geography, or social status. In theory, it is a simple principle that your chances of surviving a disease shouldn't depend on the country printed on your passport. But in practice, vaccine equity remains an ideal more than a reality. When the world faced COVID-19, we saw an unprecedented scientific triumph. Dozens of vaccines developed in record time through collaborations between researchers, governments, and private companies. Yet the same speed that brought hope also revealed the fractures in our global system. Wealthy nations pre-ordered billions of doses long before the vaccines were even approved, securing enough supply to inoculate their populations several times over. Meanwhile, low-income countries waited in line, depending on donations or delayed shipments from international programs. To address this imbalance, the World Health Organization, Gavi, and the Coalition for Epidemic Preparedness Innovations launched COVAX, a global initiative meant to ensure that all nations, rich or poor, could access vaccines simultaneously. But COVAX was never designed to compete with billion-dollar purchasing contracts. As richer countries negotiated directly with pharmaceutical giants like Pfizer, Moderna, and AstraZeneca, COVAX was left struggling to fill its own orders. By the time vaccines reached many developing regions, the pandemic had already claimed millions of lives. This crisis exposed the uncomfortable hierarchy of modern medicine. Innovation is global, but access is not. Scientific breakthroughs are celebrated everywhere, yet their benefits stop at borders drawn by wealth. Patents, production capacity, and political alliances determine who gets the cure, and who gets the leftovers. Vaccine inequality isn't just about COVID-19. It's part of a larger story that stretches across decades, from the early days of smallpox eradication to the struggles against HIV, polio, and Ebola. Every time a new vaccine changes the course of history, the same pattern emerges. Nations with resources recover first, and those without are forced to wait. That gap between discovery and delivery is where lives are lost. And it's in that space that we begin to see not a failure of science, but a failure of fairness. By the time vaccines became widely available, the world was already divided into two realities. In one, people lined up in drive-through clinics, chatting casually as nurses administered doses that promised safety and normalcy. In the other, doctors were forced to improvise, diluting remaining vials, reusing protective gear, and deciding which patient's life might be spared for another day. According to data from the World Health Organization, by mid-2021, over 75% of all vaccine doses had been administered in just 10 countries. Meanwhile, entire regions across Africa and Southeast Asia had vaccinated less than 2% of their populations. The consequences were catastrophic. Waves of infection tore through communities that had no immunity, hospitals overflowed, and healthcare workers fell faster than they could be replaced. The same virus that was fading from the headlines in one part of the world was becoming a death sentence in another. In Uganda, for instance, nurses watched helplessly as hospitals ran out of oxygen, while countries thousands of miles away were already debating booster shots. In Haiti, shipments of vaccines sat delayed at foreign ports, waiting for clearance, while misinformation filled the gap that access could not. Even humanitarian organizations couldn't move fast enough. Every shipment was a negotiation, every vial a reminder of how power decides who gets to live. But the tragedy of vaccine inequality isn't only measured in deaths. It's measured in the years stolen from recovery, the lost education, the shattered economies, the children growing up without parents, and the workers who never returned home. Every unvaccinated country became a breeding ground for new variants, turning local crises into global risks once more. Public health experts warned early on, no one is safe until everyone is safe. Yet that warning was drowned out by nationalism, profit, and political calculus. The result was predictable. The pandemic lasted longer, the death toll climbed higher, and the promise of global solidarity crumbled under the weight of self-interest. This isn't just about the COVID-19 crisis. It is a symptom of a deeper structural disease, one where access to medicine is determined not by need, but by negotiation. And every dose withheld, every shipment delayed, is a quiet admission that equality was never the goal, only survival for those who could afford it. To understand why vaccine inequality persists, we have to look beyond the laboratories and into the machinery of global power, the system that turns life-saving science into a commodity. Vaccines are among humanity's greatest medical achievements, yet they exist inside a framework built on patents, profit margins, and politics. What should have been a public good became a market product, and access to that product is determined by wealth. When the first COVID-19 vaccines were developed, pharmaceutical companies like Pfizer, Moderna, and AstraZeneca quickly became household names. They also became economic giants. Governments poured billions in public funds into research and development, yet the final products remained under private control. The formulas, protected by international patent law, could not be freely reproduced by other countries, even when millions were dying. Attempts to temporarily waive intellectual property rights, known as the TRIPS waiver, faced fierce resistance from powerful nations and corporate lobbies. The message was clear. The rules of trade outweighed the value of life. While the global north secured contracts for early delivery, many low-income nations were forced to wait months or even years. Wealthy countries hoarded doses, in some cases enough to vaccinate their populations several times over, while other regions begged for scraps. This imbalance wasn't caused by a lack of vaccines. It was a deliberate outcome of how global supply chains and patent protections were designed. The logistics of vaccine distribution further deepened the divide. Advanced mRNA vaccines required cold chain storage, special freezers that many developing nations simply didn't have. Without infrastructure or funding, millions of doses risked expiring before ever reaching rural communities. Meanwhile, misinformation spread faster than the vaccines themselves, exploiting the vacuum left by delay. The numbers told a brutal truth. In 2022, Pfizer reported more than $37 billion in vaccine revenue, while entire countries in Africa and the Middle East were still waiting for their first large-scale shipments. The very system that had enabled innovation was also the one keeping it out of reach for those who needed it most. But perhaps the most revealing part of this story isn't how vaccines were made. It is how they were marketed. Vaccine diplomacy became a new form of soft power. Nations traded doses for influence. Donations were branded with flags. Cameras rolled as leaders shook hands, and health became a currency of politics. What began as a humanitarian mission turned into a geopolitical chessboard. And once again, those at the margins paid the highest price. The inequality in vaccines, then, is not an accident. It's the inevitable result of a system that values patents over people, politics over public health, and profit over prevention. And as long as that system remains unchanged, the next pandemic will unfold the same way. The cure will exist, but not for everyone. At the height of the pandemic, the world split into two realities, one flooded with abundance, the other suffocating in absence. In the first, vaccine centers overflowed with supply. People debated which brand to choose, hesitated, delayed appointments, even joked about side effects on social media. In the second, millions waited for a single shipment that never came. For every selfie taken in a vaccination booth, there was another family across the globe lighting candles for the dead. In Europe and North America, third booster shots were being administered before many healthcare workers in Africa or South Asia had received their first. Entire nations hoarded doses just in case, while others rationed what little they had, carefully dividing vials between patients. It wasn't just a gap in access, it was a gap in time. The virus moved faster than global compassion, and by the time the doses arrived, for some, it was already too late. The contrast was staggering. In Germany, vaccine clinics operated out of sports arenas, air-conditioned and orderly, staffed by volunteers. In Malawi, 20,000 expired doses were burned because supply arrived months too late to be useful. In Canada, people argued online about brand preferences. In Uganda, doctors faced ethical nightmares. Who gets the shot when there are only 5 vials left for 50 people? The two realities revealed not only the depth of inequality, but its normalization. In the global north, vaccine abundance became invisible, taken for granted. In the global south, scarcity became routine, expected, even accepted by those who had seen it before. It was a quiet repetition of history. Medicine first flows through the channels of wealth before trickling down to the rest of humanity. But perhaps the most painful irony was this. The pandemic had proven that no border could stop a virus. Yet the world built walls anyway, using economics instead of concrete. Vaccine nationalism became the new frontier. Countries protected their own first, even at the cost of prolonging the global crisis. The slogan, "No one is safe until everyone is safe," echoed in conferences and press briefings, but in practice it was ignored. In one world, science conquered fear. In the other, fear conquered hope. And between them stood the same question that has haunted every health crisis in history. When survival becomes a privilege, what does that say about us? Despite the grim divide, the fight for vaccine equity didn't end in silence. Across continents, scientists, activists, and public health leaders began to push back, challenging the notion that survival should depend on wealth. The global health community realized that waiting for charity from rich nations was no longer a solution. Equity had to be built, not begged for. In early 2021, the World Health Organization, together with Gavi and CEPI, intensified efforts through COVAX, the global mechanism designed to provide vaccines to lower-income nations. While imperfect, it became a symbol of collective will, proof that international solidarity was still possible, even in a fractured world. Shipments began to reach countries like Ghana, Rwanda, and Nepal, marking the first glimmers of hope for populations that had been waiting for months. At the same time, several nations took matters into their own hands. India leveraged its massive pharmaceutical industry to produce millions of doses, not only for its own citizens, but also for export under the Vaccine Maitri, Vaccine Friendship Initiative. Cuba, despite decades of economic sanctions, developed its own vaccine technology, immunizing its people with homegrown doses. Vietnam, South Africa, and Indonesia launched long-term projects to build domestic vaccine manufacturing, breaking free from dependency on foreign suppliers. The movement for a TRIPS waiver, temporarily suspending intellectual property rights during global emergencies, also gained momentum. Dozens of countries rallied behind it, arguing that life-saving technology should not be locked behind legal contracts. Though opposed by powerful lobbies, it reignited a conversation that global health experts had been avoiding for years. Who truly owns medical innovation when it is built on public funding and human necessity? Grassroots organizations and NGOs played their part too. They educated communities, fought misinformation, and pressured governments to share vaccine data transparently. Global solidarity campaigns reminded the world that public health is only as strong as its weakest link. Slowly, the narrative began to shift, from charity to justice, from donation to empowerment. Technology also became a silent ally. AI-based models predicted outbreaks before they happened. Satellite mapping tracked distribution gaps. Digital cold chain systems helped reduce waste and improve logistics in hard-to-reach regions. Step by step, innovation began to close the distance that inequality had created. Still, progress was uneven. By the end of 2022, billions were vaccinated, yet billions more remained unprotected. The tools existed, but the political will did not. As one WHO official bluntly put it, the problem is not science, it's solidarity. The fight for vaccine equity became more than a public health issue. It became a test of humanity's moral infrastructure. Could we build a system where innovation serves everyone, not just those who can afford it? The answer to that question will define not only the legacy of COVID-19, but the shape of the next global emergency. The story of global vaccine inequality is not just about medicine. It's about morality. It forces us to confront a simple truth. Humanity can achieve scientific miracles, yet still fail to share them fairly. Vaccines were meant to symbolize unity, proof that the world could come together in the face of a shared threat. Instead, they revealed the fault lines that divide us, between rich and poor, between promise and practice, between survival and abandonment. For more than a century, vaccines have been the ultimate equalizer. They erased smallpox, tamed polio, and saved hundreds of millions of lives. But the pandemic reminded us that equality in health isn't guaranteed. It's negotiated, often at the cost of human lives. The power to produce, distribute, and patent vaccines remains concentrated in the hands of a few nations and corporations. And while the Global South waits, the Global North decides who gets to be safe and when. 3 lessons stand out from this crisis. First, science without fairness is only half a victory. Innovation means nothing if its benefits stop at borders. Second, public health depends on infrastructure, not charity. True safety comes not from donations, but from self-sufficiency, the ability of every region to manufacture, store, and distribute vaccines on its own. And third, solidarity must become a system, not a slogan. Because as long as the world treats health as a commodity, pandemics will continue to punish the powerless first. The phrase, "no one is safe until everyone is safe," has echoed across speeches and reports, but it was never just a slogan, it was a warning. As long as one part of the world remains unprotected, every nation remains vulnerable. The next variant, the next outbreak, the next emergency will not wait for equality to catch up. Vaccine inequality is not the failure of science. It's the failure of humanity to act as one. And unless that changes, the story will repeat, again and again, with new names, new viruses, and the same old excuses. If this story made you pause before calling the pandemic over, then it has done its job. Because the truth is, while some nations are counting their boosters, others are still counting their dead. The price of survival. Isn't it just a story about vaccines? It's about how the world measures worth, whose lives are prioritized, and how fragile global solidarity really is when tested by fear and profit. Clean water, clean air, and life-saving vaccines should never be luxuries. They are the foundation of justice, not the privilege of geography. The fight for vaccine equity is not charity, it's accountability. Every breakthrough, every dose, every vial is a reminder of what's possible when science serves humanity instead of markets. But real change won't come from governments or corporations alone. It begins with awareness, with people who refuse to look away from inequality simply because it happens far from home. The next time a pandemic emerges, and it will, the lessons of today will decide how many survive tomorrow. So if this story resonated with you, don't let it end here. Share this video, start the conversation, and subscribe for more explorations into the hidden systems shaping global health. Because the future of humanity's survival depends not on the strength of our science, but on the fairness of our choices. In our next episode, we'll uncover another invisible war, how global air pollution has become the deadliest environmental killer on Earth, claiming millions of lives each year while hiding in plain sight. Until then, remember, health is not a privilege, it's a right. And the world's survival will depend on whether we finally start treating it that way.